everybody. Welcome to our Monday Minute. Today, I'd like to discuss some coding issues that apparently is the number one question that comes to mind when you are discussing coding in home health, especially under medical review. So recently, Healthcare Provider Solutions provided a free webinar that was specific to coding in home health and the updates that are coming very shortly with the ICD-10 diagnosis codes. During that webinar, we had tons of questions, with the primary focus of those questions surrounding our section of the webinar that was specific to the requirements of the face-to-face encounter and the coding aspect under medical review. And so we wanted to clarify today that in order for your face-to-face to be valid at the start of care of a home health episode, the face-to-face encounter, of course, must have occurred within 90 days prior to the start of care or within 30 days after. In addition to that, it must be, of course, conducted by an allowed practitioner. The document must be the encounter note itself from that visit. It must be signed and dated. In that face-to-face encounter, there must be evidence that the primary diagnosis that is going to be used in the home care episode was treated. So if the patient's primary focus of care for home health is diabetes, diabetes must have been treated during the face-to-face encounter. It is imperative that you understand the significance of this not occurring, because not only can, under medical review, could you get a denial for the first 30-day period and that primary diagnosis not matching, you could get a denial for multiple 30-day periods, because when they medically review any 30-day period, they're going to review the initial certification requirements, which include that when that patient was admitted, the primary diagnosis, the focus of care, was treated during the face-to-face encounter. Of course, as you continue through the care of that patient, the subsequent 30-day periods, the recertifications, etc., the primary focus of care can change and then has no bearing on what was done during the face-to-face encounter. I also want to clarify for face-to-face encounter purposes that if a nurse practitioner is now allowed in your state to certify patients for home health, and they are signing the plan of care, if the face-to-face encounter did not come from a facility, the face-to-face encounter must be done by that nurse practitioner. It cannot be done by another community physician. Again, the encounter can be done by a facility in which the patient has been directly referred to home health. But if it is a community face-to-face encounter, it must be the nurse practitioner that is signing your care plan that conducts that face-to-face encounter. I hope that today has been helpful. If you have any additional questions regarding the face-to-face encounter or the coding aspect of that, please do not hesitate to let us know. I hope you have a fabulous week. It has been such a joy seeing many of you face-to-face over the summer in your state association conferences, and I hope to continue to do so as we move into the fall, continuing with those live conferences. Make sure that you also continue to support the state and national home care and hospice associations in their advocacy efforts to get the legislation passed to prevent decreases in home care rates through 2026. Thank you all and have a great week.